Good afternoon. Welcome to the St. Clair County EMA briefing. I'm joined today by Director Herb Simmons and Director Barb Holt from the St. Clair County Health Department. Barb, you have today's information for us.
I do. Thank you, Brian. Hello, everyone. I'm going to give a quick shout out to a buddy of mine I used to play some softball with, Stephanie Hawks. She liked my cat mask. I don't know where it came from. I got it as a present. So can't help you there, but thanks for the shout out, and everyone. Hope everybody has a little bit of fun with your mask in the holidays and bring a little bit of a light and smiles behind these masks, even though we have these COVID situations here. So with that, I'll give you today's St. Clair County updates. So thus far, we have tested 163,061 folks, and that makes an increase for today of 1,622. Of those, we have 209 positive cases, including males and females under 1 year of age into their 90s. That makes our St. Clair County daily positivity rate for today of 12.9. Went down somewhat from yesterday. It was at 20% yesterday. That makes our total positive cases we've had at 15,678 and a total of 147,383 negatives. Our death rate still remains at way too high at 260, and as we reported yesterday, the state of Illinois had their highest rate ever of 230 some deaths. So on with the state rates, we have tested 10,806,346. We have a total of 759,562 positives. That's an increase statewide of 10,959. Again, a high number of positive cases in the state and another high number of deaths in the state in the last 24 hours of 192 deaths for a total of 12,830 folks that have died in the state of Illinois due to COVID-related illness. Again, our thoughts and prayers go to all those family and friends of those that had passed due to this horrible pandemic disease. Hospitalization numbers in St. Clair County, we have 99 COVID-related patients that are hospitalized, and 9 of those are on ventilators. Region-wise, we have 229 patients in the hospital due to COVID-related illness, and 23 of those are on ventilators. Again, our hospitals are very, very busy, not only with COVID patients, but other patients as well. So let's do the right thing and make sure we stay healthy and stay out of the hospitals. For our congregate living center and outbreak status, we have 1 additional case to add at Brea of Belleville for a total of 74 cases and 8 deaths. At Mercy Rehab and Care Center in Swansea, we have 1 additional case for a total of 30 cases and no deaths. At the Caseyville Nursing and Rehab Home, we have 13 additional cases to report today for a total of 129 cases and 3 deaths. And at Cedar Ridge in Lebanon, we have 2 additional cases for a total of 137 cases and 17 deaths. And finally, at the Freeburg Care Center, we have 1 additional case for a total of 14 cases and no deaths at that facility. Again, testing sites, as Herb announced yesterday, we have a testing site now at St. Clair Mall. It's a covered 4-lane drive-through facility, and that is open 7 days a week from 8 to 4. We also have a testing site tomorrow, a pop-up site at the Clair Fairgrounds. This is a walk-up site from 10 to 12 and from 1 to 4 tomorrow at the fairgrounds. That's a walk-up. And then next Tuesday and Wednesday, December 8th and December 9th, from 8 to 4 both days. This is at the McKendree University in front of the Het, and these are drive-through only. Originally, we said they were drive-through and walk-up, and we've changed that due to weather conditions. Drive-up only, both Tuesday and Wednesday, 8 to 4 at McKendree University. And then we just have one more to add at the New Life Church on Scott Troy Road on Sunday, December 13th. And that one will be from 8 to 4 as a drive-through. That one's fresh off the presses. So with that, I will turn it over to Mr. Herb. How are you today, sir?
It's getting towards the end of the week.
Is there
who
an
cares?
end
There's
of a
no
week?
end. We
I mean, is it
appreciate
ever end?
Thanks, Barb, for those numbers. We'll go into the zip code report. 62201 goes up 3 to 394. 62203 goes up 6 to 401. 62204 goes up 4 to 256. 62205 goes up 2 to 402. 62206 goes up 6 to 771. 62207 goes up 2 to 387. 62208 goes up 8 to 899. 62220 goes up 4 to 1062. 62221 goes up 13 to 1454. 62223 goes up 5 to 948. 62225 goes up 1 to 77. 62226 goes up 22 to 1,680. 62232 goes up 17 to 508. 62239 goes up 3 to 232. 62240 goes up 1 to 77. 62243 goes up 4 to 326. 62254 goes up 1 to 510. 62257 goes up 1 to 149. 62258 goes up 6 to 578. 62260 goes up 3 to 358. 62264 goes up 2 to 171. 62269 goes up 14 to 1,595. 62282 goes up 1 to 36. 62285 goes up 7 to 311. As Barb said, our daily county positivity rate went down from 20% yesterday to 12.9, which is going in the right direction there. The regional positivity as of November 30th stays at 14.1. The other counties came in today, Bond County at 20.2%, Clinton at 7.5%, Madison 15.7%, Monroe 11.9%, Randolph 9.4%, St. Clair 9.5%, Washington 26.4%. The county 7-day rolling average is at 14.5%. Which is down from 14.7. So, Barb, we've seen a little decrease on some of those numbers. So that's the good thing. You know, I think it's got to be better, but we are seeing just a little bit of going down.
Just a little bit. We hope it continues going that way. Again, typically after a large gathering or holiday, you usually see the spike come a week or two afterwards. So a week ago today was Thanksgiving. So we're
Any
we're
day
just-
we should be
any
seeing
day.
those numbers there. We're still getting calls about enforcement. You know, we keep referring them to your office and to the local municipalities. And I know that your staff is working hard on trying to get compliant because that's what it's all about.
Absolutely, and I would like to elaborate a little bit more on our policy and procedures that we have for enforcement. And this is specific for COVID-related complaints. Ever since the Tier 3 mitigation orders went into effect, we have our policy states, and this goes along with the state mitigation orders, and they're outlined for enforcement. The first time, we'll do an educational contact to the individual, either call them or visit the facility and ensure that they understand what the rules mean and educate them. Again, as we have said in the past, we don't want to be punitive. We want people to follow the rules as they are outlined by the mitigation orders. Second time we get a complaint and it's a validated complaint, we'll issue a compliance notice that we put it in writing on such and such date. You are either indoor dining or no mask or not social distancing or violating the mitigation rules in whatever fashion. That's the second complaint. Third time around, we get another complaint, we'll do the same thing, issue the orders. All along for each of these violations or each of these complaints, and that they're valid, we forward the information on to the local mayor and police department. both for the municipality or for the county, to make them aware of the complaints we're getting about the what's going on within their community. And then the third time around they get a written violation, we're evaluating those situations, and we have the right by our policy and by state law and our food sanitation ordinance to suspend their food permits. So for those that are blatantly violating the laws and endangering the safety of the public's health, because we have all these gatherings and our numbers, even though they went down a little bit today, showing it is so easily spread in the community, we will be suspending food permits.
Well, and that's, we get calls all the time. In fact, I know the county actually took action today at a liquor hearing on 2 different establishments that went through the process of being warned on numerous occasions. One of them had a violation back early on during the pandemic and didn't want to adhere to the mitigation, and so they had a hearing today, and both of their licenses have been suspended from the county side. So it's we sit here and we've been saying all along for 265 days, it's rough. We understand it's rough on businesses, and we sympathize with them, but we also have to look at the public safety of the citizens of the county. And if we could just all, take it a day at a time here. And the vaccine, we talked about that earlier before we went on the air. That's that light at the end of that tunnel, even though, as Dr. Fauci said yesterday, it's a long tunnel, but we can see that light. And I know you and the staff are making the plans with the vaccines, and that we're going to be having a lot more of that coming up in the next few weeks. So
Absolutely. We just we're on a vaccine conference call with our local community partners as well as the hospitals, and working on rolling out those plans as CDC evaluates the safety and efficacy of the vaccines. And hopefully our medical providers will be getting some of that before the end of the year into our medical providers' hands.
And that's what we've been waiting for, because, if we can get that going, get the numbers down, we can get back to some sense of the normal, what that's going to be. I don't know if we'll ever get back to where we were the way we knew it, I'll tell you. But for 265 days, we've been preaching it to you. And Team St. Clair, just keep hanging on there. Like I said, every day we sympathize with everybody. We know everybody's stress level is way up. Everybody's angry. Everybody's wanting to go out and do this and get things done. But with the holidays here, it's even that much more difficult. But there is light at the end of that long tunnel, as Chairman Kern and I said yesterday when we were on the call with Dr. Fauci and other members, that there is that light. It's getting brighter. You just heard Barb say that the vaccine, it's a lot more than just sitting here every day putting these numbers out there and giving you that information. Her staff, the staff here at EMA, is working all the time to try to bring you the most up-to-date information that we can, and hope that light continues to get brighter at the end of the tunnel. And we know it's rough. And when I read some of the statements that are made, we understand everybody is suffering. But our enemy, the invisible enemy, that virus, don't care. They don't care that we're suffering. They don't care that we're not allowed to go out and do what we're supposed to do. It's our enemy, and we have said that from day one. It's our invisible enemy, and but we will get through this, as we've told you for 265 days now. We'll be back with Cindy and Daisy to translate this into our Spanish communities in just a few moments, and then we'll see you back here tomorrow afternoon. Have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket, where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.